Thanks, Fred, for your very kind words. Really appreciate the leadership you've shown not only here but nationally on palliative and other issues. So hello, everyone. I'm honored to be here with you this week. On behalf of the Covenant Health Board of Directors and the Covenant Health Leadership Team and our Palliative Institute, I offer my sincere gratitude for all you have done in the past few days with us. We came together to discuss one of Canada's most important issues facing healthcare. We are standing at a historic moment for palliative care in Canada. It's a moment of privilege, a moment of challenge, a moment of change. For Covenant Health, this moment marks a major milestone in a journey deeply rooted in our mission. A mission rooted in the deep belief of sacredness of life, the dignity of all persons, care for the whole person in community. Our mission rooted in compassion, walking with each other as people in kinship, in deep relationship with one another. A calling rooted in legacy of our founding congregations. Congregations of women who simply said, no one should die alone or in pain. We can simply just do better. A calling that has driven us to innovate and lead the way. A calling that compels us to say, we must walk with others at their time of greatest need. And it's a calling that we all share here today. We've done something that's simply extraordinary here this week. We've done things that would make the sisters very, very proud, and all of our pioneers in our health system very, very proud. We have worked together in good faith in the spirit of community. We have listened to each other with respect and a deep sense of responsibility as providers and people served. We've heard voices of patients, their families, their caregivers, and those who may not even have a profession related to palliative care, but have a passion for caring. We've asked tough, complex questions and simple questions with tough answers. We've considered all the evidence, taking time for reflection and discernment. We've shaken some trees and maybe even shaken a few foundations, and we've arrived here at this place, united and determined. As we prepare to hear the work of our lay panel and the wisdom and insight that comes from this concert, we are standing at the beginning of something pretty incredible. We're at a point where we, as Canadians together, decide what we want palliative care to be in our country. A consensus that promised to take us forward in a future of quality, consistent, and accessible palliative care across Canada. So on behalf of Covenant Health, I can say we are full of hope and gratitude. We will use the knowledge and awareness that we've gained here in our own practice. We are committed to transformation and creating the vibrant community's hope and healing that every Canadian needs to see them through their darkest days. We are committed to seeing this through, and most importantly, we want to continue this journey with you together. Earlier this week, Jim Mulcahy said we must widen the circle of care, and I believe we've done that here this week. The circle is big, it's broad, and it's strong. It includes every one of you here, the 1,500 people who took the Ipsos survey, and hundreds more who have joined our webcast from around the world. I want to especially acknowledge some of the people who are essential to this effort. The conference co-chairs, Karen McMillan and Fred Horn. Thank you for your leadership, vision, and perseverance. I can tell you that their work is nothing short of remarkable. Our steering committee and reference groups and our expert panel, thank you for your knowledge and your expertise and for really guiding the process. To Don Newman and the lay panel, thank you from the bottom of our hearts for your passion and your wisdom, for giving us so much of your time and your energy. You are the beating heart of this conference, and we are humbled and grateful for your contribution. To the entire conference team, Carlene, Conrad, and Jewel, this has been an absolute knock it out of the park home run. So I said to them, I had high expectations. They pitched me hard on this a year ago, and they have not let me down in any way. And so thank you so much. Amazing job. I also want to acknowledge our founding congregations of sisters. Not only are they back home praying for us, but they decided to put $500,000 in to support this important initiative. Them with the Covenant Foundation, who also put $250,000 into the project. So without the sisters really putting their money where their hearts and their mouths are, we wouldn't be here today. And of course, the huge thanks to the 14 national organizations who are our sponsors in this effort. Thank you for your time, your resources, your communication networks, insight, and expertise. But more importantly, thank you for your partnership and your moral and strategic support. We are at the end of the second phase of the Palliative Care Matters, but the work is by no means over, as Fred and Conrad have said. We look forward to the work of the Conference Board of Canada and the report early in 2017, which will lay the foundation for the real change to come. In the meantime, we encourage you to take back what you've heard here to your operations, your advisory committees, your staff, your patients, your families, and even the elected officials that you might know for further discussion and sharing. So thank you for your participation and your passion. I look forward to continuing this journey together. Thank you.